My name is Elena Rojas, and Christina Farley, Savannah DeBells. We are all together in the group to explain a little about the Certified Registered Nurse Anesthetist. Introduction. Well, in this presentation, we will discuss a brief history of the nurse anesthesia leading to the APN CRNA role. We will also discuss the current role, requirements, areas of practice, scope of practice, competencies, standards of care of the CRNA. We will highlight a few of the issues faced by the profession as well as the future of this profession. Well, for the history, nurse anesthesia dates back to the Civil War. CRNAs is the oldest organized APN specialty traced back to the late 1800s, with the first program started in 1909. The CRNA was the first APN to receive direct reimbursement for services. There are currently 114 accredited programs in the U.S. The CRNA role. So CRNAs are the primary providers of anesthesia and anesthesia care in rural areas. In fact, some states have the CRNAs provide the anesthesia care before, after surgery, therapeutic, diagnostic, and obstetrical procedures just by themselves. And of course, in bigger hospitals, bigger cities, they're part of a whole team. They also provide pain management and emergency services such as airway management and ACLS, all those things. The CRNA requirements. So for general APN requirements, for all the 4 APN roles, we found in Chapter 3 that we need to include, they need to have the graduate education on population focus, the 3 Ps, the advanced pathophysiology, pharmacology, and physical assessment. Then certification and direct care of patients and families also need to be just as part of the APN. For the CRNA, they need to hold a current RN license, have a bachelor's degree, complete at least 1 year in acute care setting, graduate from accredited nurse anesthesia program, complete the national certification exam, and then they need to have biennial recertification by the National Board of Certification. And then to be recertified for the nurse anesthetist, they need to have a current RN license, have active practice as a CRNA, have their continuing education, and also they need to have a verification of absence of mental and physical problems or any other problems that can interfere with the practice. For the CRNA practice arena and scope of practice, well, CRNAs practice both autonomously and in collaboration with a variety of providers. On the interprofessional team, they deliver high quality, holistic, evidence-based anesthesia and pain care services. Nurse anesthetists care for patients that actually are all in different acuity levels across the lifespan, in a variety of settings of procedures, including but not limited to surgical, obstetric, diagnostic, therapeutic, and pain management. CRNAs serve as clinicians, researchers, educators, mentors, advocates, and administrators. For the CRNA scope of practice, so part of their scope of practice includes obtaining the informed consent before the procedure is going to begin. They need to ask the patient have any questions or clarify anything that it's maybe confusing for them. Then they need to start pre-anesthetic assessment, including diagnostics and consultations, administering the pre-anesthetic medications and fluids, develop and implementing the anesthetic plan, initiate the anesthetic technique, either if it's going to be general, local, or regional anesthesia or sedation, monitoring for continuous evaluation of patient physical status, also managing their airway and pulmonary status. facilitating recovery, either discharging from and to PACU, manage acute and chronic pain, and responding to basically any kind of emergency situation, providing airway management, administering fluids and medications, and providing cardiac life support techniques. Additional roles of quality management, education, and administrative duties are also part of their scope of practice. The CRNA competencies and standards of care. So as part of the CRNA's competencies, they need to use holistic perspective. They also need to use formation of therapeutic partnership with patients and other providers, expert clinical thinking, and skillful practice. They also need to use reflective practice, use of evidence as a guide to practice, use of diverse approaches to health and illnesses, utilize guidance, coaching with patients, also consultation with other providers, and collaborate using evidence-based practice again, and always practice ethical decision making. The CRNA role, issues and challenges. So more than before probably, the physicians see APNs as a threat to current practice, and it is a challenge that is expanding roles and delivering care and decision making. However, the Institute of Medicine backs up nursing as they need more CRNAs because of the cost effective for healthcare as it is increasing. So CRNAs are less costly to train than anesthesiologists and have proven to provide the same set of services without increase of morbidity or mortality. The number of future retiring CRNAs is increasing. So there is an increased demand for CRNAs. The requirement of the doctorate for entry level is also another challenge. Before it was, they wanted the doctoral education by 2015. However, with this role continuing in advance in the direction and the challenge to redesigning the whole curriculum, they were able to push it to 2025. But those are all part of the challenges of the CRNAs right now. In the future of the CRNAs, well, the aging population is increasing, as we all know. So there is a need for more CRNAs. Now, with the cost-effective and safe care, they're proven to be needed and to provide the same care for all this increasing population. However, in the future, with the implementation, and already now, with the implementation of the Patient Protection and Affordable Care Act in 2011, there is an increase in the number of surgeries and procedures, so they need to have more CRNAs. And more futuristically as well, there's gonna probably be more CRNAs providing the care, the anesthetic care in rural areas, and even is growing up in other communities. Well, in conclusion, a recap is CRNAs are a vital part of medical community. They're essential in the care of the patients in various settings. They provide anesthesia services in a variety of settings, and they collaborate with many, many other physicians and providers. There's an optimistic future for this amazing APN role. And these were references. Thank you, class.